Hello, welcome to Stroke Tips. We're going to talk about Pontine infarct or Pontine stroke. We're going to present it in a very simplified review to help you understand the symptoms of a Pontine infarct. Neuro tips are for medical professionals. We provide useful information within a few minutes. When a patient presents to the emergency room and CT scan of the head is negative, as most brainstem stroke will not show up on the CT scan in the acute stage. Pons is located in the brainstem, is in the middle part of the brainstem. Pons blood supply is mainly supplied by branches of the basilar artery. As you can see from this arrow, the basilar artery provides branches to supply the blood to the pons. This is another view of the blood supply from the basilar artery to the pons. Branches from the basilar artery would go into the medial part, the lateral part, and the far lateral part of the pons. The important structures in the pons are displayed here. The most important structure is the seventh nerve nucleus, and the seventh nerve is indicated by the blue color on the diagram. And then the sixth nucleus, or the abducent nucleus, and the sixth nerve is indicated by the red color. And then we have the corticospinal tract. Corticospinal tract are the nerves coming from the cortex that go down through the brainstem into the spinal cord and control the opposite side of the body and limbs. Another important structure is the cerebellar peduncle that connects the brainstem to the cerebellum. This is another view of the pons with only the more important structures. Starting from the top, there's the fourth ventricle, the cerebellar peduncle, the facial colliculus, the abducens, or the sixth nerve nucleus, and the sixth nerve that's connected to the nucleus. And under that is the facial nucleus that produce the facial nerve that exit from the pons. And in the bottom one, that is in the front, is the corticospinal tract. The next, we're going to talk about the functions of the different area of these important structure in the pons. So the most important is cerebellar peduncle. It controls coordination of the limb on the same side. The next one is the abducens nucleus, and the abducens nerve, which is also called the sixth nerve. It controls abduction of the eye, that is moving the eye laterally. The next is the facial nerve and the facial nucleus. It controls the facial movement on the same side of the face. And the last but not least is the corticospinal tract. It controls the motor function of the extremities and body on the opposite side. If the patient has a small stroke, such as indicated on the orange color triangle, and it can affect the facial nerve, and it can cause the facial paralysis. If the stroke is on the medial side, it can affect the sixth nerve and the corticospinal tract, and it would cause inability to abduct the eye, and also has difficulty moving the limbs on the opposite side of the body. And if the stroke is even larger, the facial nerve is affected, the sixth nerve is affected, and the corticospinal tract is affected, then the patient would have 6-nerve palsy, facial paralysis, and hemiparesis on the opposite side. And for a very large stroke, the patient would have facial paralysis, 6-nerve palsy, and ataxia on the same side, and hemiparesis on the opposite side. So when a very large left pontine infarct, it may cause nausea and vomiting, vertigo, left ataxia, left facial paralysis, left eye inability to abduct. And on the opposite side, the patient will have right hemiparesis. The symptoms mainly depend on the size of the infarct and the location, and the patient will have a combination of the above symptoms. Hope that will help you understand a Pontine infarct. Thank you very much for your attention. Bye. We'll see you again soon.